Applestosen. It's Dr. Bob here with another health and vitality tip of the week. You know, one of the most devastating things you can ever have happen is have decay of the nervous system. The problem is, if we are not moving our body and not keeping our spine in proper alignment, it literally starts to choke or strangle off the nerves as they come out of the spine, or actually the spinal column itself. Unfortunately, the medical route will typically say you have this thing called arthritis, and you blame arthritis on everything, every little ache and pain. But most of the time, it's something where the body is not functioning properly. So the most common type of arthritis is called osteoarthritis, which means the arthritis of the bone. There are literally 100 different types of arthritis. Arthritis means joint inflammation. So our diet can actually create an arthritic type of pain, but wear and tear, misalignment problems are what is the most common thing. So if the spine or a shoulder or an elbow or a wrist is out of alignment, that's called a subluxation. If you break that word down in Latin, sub means below the surface, like a submarine. Lux means light or energy. Ation means condition. So a subluxation is a misalignment of the spine that affects the nerves. It affects the joint misalignment. It affects disc bulging. It irritates or stresses the nerves, and it actually causes a decay of the shock absorbing system. These are actual rateable conditions that you can actually see how bad different levels of the spine are. Most of the time, if there's a stress point on the spine, it's going to affect a specific level and a specific nerve. As a chiropractor, our main focus is to keep your whole body in proper alignment, your posture upright, your body moving properly to prevent spinal decay and arthritis. We have dozens of patients that are in their 90s and above that have been patients for many years, and they say that one of the reasons why they're still moving and functioning and doing all their activities, actually living on their own still, and have good brain function is because of keeping their spine and nervous system healthy. It is important to make sure that we are not stressing the spine. So if we look at the curves of the spine, you should have a normal curve that develops early on in life. Shock absorbing system is 7 times stronger. There's a curve in the lower back. So a lumbar support when you're sitting, back sleeping is best with a pillow up underneath your knees. Side sleeping would be second best with a pillow between your knees. Never sleeping on your stomach because it twists up the spine and you have all these contortions, and this is what your spine looks like throughout the day. So if you have chronic problems which you think have been diagnosed with arthritis or disc problems, make sure that you get your spine checked to make sure that it's in proper alignment and balance. So the nervous system is your master system of your body. It controls everything. If you are blocking the messages from the brain to the body from this thing called a subluxation, the brain-body connection is not creating this feedback loop. It affects your brain health. It affects the health of your spine and nervous system. If you look at a spine that does not have proper alignment from maybe a car accident or poor posture for pretty years, or head is shifted backwards, this goes into what's called a phase 1-2 level of spinal decay over a period of 5, 10, 20 years. And then as we get older, we have advanced degeneration and degenerative disc disease. Degenerative disc disease, if you take care of your spine, is preventable. And you can slow it down, and in many cases, reverse and stop the progression. So make sure that your spine is in proper alignment. Get a chiropractic checkup. Make sure that your family is in proper alignment, because it's important to pass on those health tips to your kids and your grandkids. So this is another health and vitality tip of the week. Get a spinal checkup. Check to see if you have subluxation to prevent arthritis and spinal decay. Until next time, it's Dr. Bob. Applestosen.